Now, when you have an absolute indication for the surgery, like the patient is reporting to you with a recurrent intestinal obstruction, or actually the patient is presenting to you with a fistula or the perianal disease, so there are multiple options for the surgery you can go first. For example, if there is a limited perianal disease, then what you have to do is like you have to treat the abscess, or you have to treat the perianal fistula with the placement of the ceton, or you can there are a number of options you can do. But in case of the disease, especially limited to terminal ileum, the option you have is the ileal resection, or you go for proper anastomosis. So it depends upon the extent of the disease. So most commonly it's the terminal ileum in like 70% of the cases, and in almost 20% of the cases there is a combination of the colitis as well. So the patient can have the Crohn's colitis with the terminal ileitis, and then you have to think about a surgical option which can address both the terminal ileitis and the Crohn's colitis. Plus, if there is proctitis and the patient is reportedly presenting to you with the same complaint, and you know that in the background there's a Crohn's disease, then you have to go for that particular treatment. So we will be discussing the surgical options we have available for the Crohn's disease and when to perform the surgery, like proper indications. The role of a laparoscopic surgery is, increasing day by day, because it's a kind of a minimal invasive surgery. And the advantages of the laparoscopic surgery is the better wound healing, and the proper small incision, and which can give you a proper view of the intestine. But there are some complications with the laparoscopic surgery, and especially if you want to explore whole of the small intestine, then with the help of a laparoscopic surgery, it becomes kind of a difficult thing. But there are some conditions in which you can perform if you have done a CT scan, or you have done a preoperative imaging, and you know that the problem is only in a limited portion of the gut, then you go for the laparoscopic surgery. Like if there's a colitis and you have to perform the colectomy, then you can do a laparoscopic surgery or there is a terminal ileitis, or the terminal ileum mass is present, then you can go for a laparoscopic surgery, especially if preoperatively you have a proper documentation and the CT scan is actually in the favor of a focal disease. But if there are multiple skip lesions and a vast extent of the intestine is involved, then you have very limited options, and the most important thing is that you have to explore the whole of the gut, and you have to see the whole of the gut, and you have to see the duodenum, the jejunum, the ileum, and the colon, because there can be multiple skip lesions, and you might end up missing something, and the patient can actually present to you again with the same complaints, and the failure of a medical therapy, and then the failure of a surgical therapy, that is quite disturbing for the patient. So for a proper exposure and to look for the whole of the segments in identifying a proper disease segment, laparoscopy is not the choice. Then you have to convert. Maybe possible that you start off with a laparoscopic surgery, and when you encounter that there are multiple skip lesions and you have to explore the whole of the small intestine and the large intestine, then you have to convert the laparoscopic surgery into the open surgery, and then you have to do the definitive surgery. But for the starters, and for a focal disease, you can end up, if it's a terminal ileitis and only the ileal resection is to be done, or colectomy is to be done, then you can do with the laparoscopic surgery. But for the advanced disease in which there are multiple skip lesions and you need to explore the whole of the gut, then you have to convert the laparoscopic surgery into the open surgery.